Hello friends, I'm Dr. Pooja Kapoor, Pediatric Neurologist, Director and Co-founder Continua Kids. So today let's have a word on role of Applied Behavioral Analysis Therapy or ABA on autism spectrum disorder. So there are two approaches which are used for the treatment as a treatment modality for autism spectrum disorder. The first is focused or localized approach. What do you mean by that? So a certain example of that is, suppose my child is lagging exclusively in the speech and language domain. So I will start with a speech and language pathology for the pathologist for the development of this domain. Suppose my child is lagging in academics. So as a reinforcer, I'll put him in a special educator with a special educator. So for the development of academic skills. So these are very focused approaches and these are very much specified for those domains where the child is lagging. Similarly, the other concept is a comprehensive based approach. So ABA is a comprehensive based approach which helps in the development of all the domains in which my child is lagging. So my child has certain concerns in the speech and language. Also, the child has certain stereotypy or regressive behavior which are not allowing for the other development of skills in my child. So this child requires an ABA based therapy, whereas for the comprehensive development of the child, we will deal with each and every aspect of the child. So how it is based on what principle it is based on? It is believed in ABA that a certain type of behavior is because of the regular recurrent antecedent incidences which has happened and which leads to a very different type of behavior. So if you want to reduce that behavior, you have to study the antecedent incidences and then you minimize and work on that and make a program for the reduction of these incidences, leading to the regression of these aspects. Similarly, for the development of certain social skills or other skills, you put in a lot of program-based approach, which is dissected. The domain is dissected into very, very small targets, and then you build up those targets by recurrent, everyday, putting up the effort on that and developing that skill in a sequential manner. So, how many hours are required for all these things? So they say a minimum of 2 hours per day is required, and that could go up to 5 hours per day depending on the child. So the duration per day is dependent on the child, the symptoms, the severity, and how much the requirement a child could take in. Who could design these programs for the child? So these are specified board certified BCBA therapists who design and program these for the children, and they are the one who chosen the time, the requirement, what should be done, the program, and based on that the therapist executes it. So this is the thing, how the ABA works, what is required, who does it. Let's meet in some other time in the next video for other aspects of ABA. Thank you.